Since 2016, more than 32,000 Canadians have died from opioid overdoses. Well, right now in Montreal, the city is experiencing a rise in deaths related to the highly addictive painkillers. In response, new safe injection sites have opened their doors, but the facilities are not without criticism. Some claim they turn residential streets into quote-unquote crack alleys. With more on this, let's go to Alex Berthelot, the Director of Community Service over at CACTUS. Alex, welcome to the program.
Hi, Elias. Thank you for having me.
So, Alex, let me just put my cards on the table because, I think you should know where I'm coming from and my biases and that, right?
Sure.
So, I used to be someone, you go back 10 years ago, if you had asked me, hey, should we have these resources? I would have been so on board, okay? I would have been like, yes, we should have a safe injection site. Yes, we should have these resources. And now, 10 years later, boy, have I changed on this one. And the reason I've changed is, A, I've lived downtown now for the last 4 years, and I see what is happening on my streets. And then I hear from other people who live downtown, particularly around CACTUS, who have said that since CACTUS opened in 2017 in their neck of the woods, their condos, their streets have become a den of drug use. And I have serious questions as to whether or not services, places like CACTUS are good or bad. I'm leaning now more towards that they're bad. Make the case that I'm wrong.
Okay. Well, good thing to know where you're coming from. Listen, I can tell you that they are an absolute necessity right now with the overdose deaths climbing through the roof right now. But it's not just overdoses that we prevent, right? We are in the business of harm reduction, so reducing both harm to the individuals that frequent our site and that are users of psychoactive substances, as well as reducing harm to the community. People that are using safe injection sites are people that are not out using in public areas. When there's a safe injection site around, there are people there to collect dirty and used paraphernalia so that it's not lying out on the street for people like yourself to come across. We help meet the basic needs of the users that are there. Obviously, we can't deny, especially in the case of CACTUS right now, that there's been a spike in the number of users that are coming to our site, and that has some impact on the residential streets around where our site is. But I'm just going to ask you to imagine a world where CACTUS doesn't exist.
Yeah.
And where all those people would be. Yeah.
Okay. So here's the counterpoint that I hear, right? And maybe this is where we head to next. And that if we're in the world where CACTUS doesn't exist, right? Mm-hmm. Drug use is actually harder. Like there are people that say that services like CACTUS make drug use easy. And that leads to more drug use. That's the argument that I'm hearing. I have no data, by the way, to support this. All I know is what the residents on those like Berger and Charlotte streets right around you. Yep. They say their lives are miserable. Like they're in their condos, they're walking on the staircase, and there's someone who's partially naked, and they've just consumed drugs, and they're on the staircase, and it didn't happen before. Right? So that's what I'm going with. I'm just trying to find the answers here. I don't know what's right. I just know those residents, they feel that safe injection sites made their lives worse.
Right. So safe injection sites, first of all, what you need to understand is about the selection of locations. Mm-hmm. Safe injection sites don't open in neighborhoods that don't already have a large drug abuse problem, right? Mm-hmm. We don't go set up in the middle of Westmount, for example. If a safe injection site is set up in a location, it's because the population that we seek to serve is already there. There's a geographic proximity already with the people that are there. Mm-hmm. And there's a lot of factors that come into the concentration that we're seeing right now in front of Cactus Montreal, and one of them is, in fact, the presence of condos and the development and the gentrification of urban areas. Right? We've seen this Barry Square that's been co-opted and changed into Les Jardins Gamelin. It's been fenced off. Access isn't really there anymore for the people that used to use it. The same thing down at Viger, the same thing in Peace Park. And so the number of locations where people used to kind of go out of the way and out of the public eye to consume are inexistent now. And so we're seeing a higher concentration in the few spaces that these people still feel safe using. And one of those spaces is at Cactus Montreal.
How many hours a day are you open?
We are open 12 hours a day, so from 2 in the afternoon to 2 in the morning.
And the 12 hours you're not open, do drug users stop consuming? Because my belief is they continue to consume and they'll do it around the areas where you are.
Of course. Drug users don't stop using drugs because Cactus Montreal isn't open. Same thing as they don't use drugs because Cactus Montreal is open. We're not there to facilitate making drugs easier. We're there to make it safer. The whole idea, we would love to be open 24 hours a day. If I had the money,
yeah,
like literally, if Health Canada or the regional director of public health were to sign me a check for another $4 or $5 million, I would open up my safe injection site 24 hours a day, no problem.
Alex, are there other cities in Canada that they have the safe injection sites open 24 hours a day? And was that the magic trick in order to start to reduce what we see on streets?
Well, I mean, I can't really speak to what's going on in other cities right now. I know that surely in Vancouver there is 24-hour coverage in some areas of the downtown east side of Vancouver. And yes, there's probably an effect on reducing the number of people that are out using in public. And even here, like, we're only open 12 hours a day. Well, we have 70 or 80 users that use our safe injection site every day. And those are 70 or 80 people that aren't using in your stairwell. Those are 70, 80 people that aren't using in your parking garage and that aren't using on a public street or using in children's parks.
Yeah.
I do believe that is part of the solution.
Alex, you talked about if we're in a world where Cactus didn't exist because there were no resources for services like yours. But how do we get to a future where Cactus doesn't exist because it's mission accomplished and services like yours have gotten people off drugs? Okay, well, I guess first off, we need to kind of wade into this territory. Our mission is not to get people off drugs, right? Yeah. We are a harm reduction organization. We work under the philosophy that regardless of whatever interventions we do, there is always going to be a certain percentage of the population that are marginalized and that have substance abuse issues. That's kind of a fact of life. Yeah. And we've seen it in prohibition campaigns time after time after time. It doesn't matter how much repression you put into something, there is still going to be that certain amount of population that uses drugs. So our real mission is to reduce the effects of that drug use on the individuals and to reduce the effects of that drug use also on the communities that are surrounding those individuals and that those individuals live in and that they're citizens in as well. Alex, I want to thank you for coming on and having this discussion with me. We may disagree right now at present on safe injection sites and services like yours, but I know we both want the same thing. We want streets, where people live to be safer. So let's continue talking, okay?
Yeah, for sure. You can invite me back anytime. I'm happy to talk to you about the services that we offer, the challenges we face, and our hopes for development for the future of programs like CACTUS Montreal and the other safe injection sites that exist in Montreal, because we're not the only ones.
Take care, Alex. I appreciate it. That's Alex Berthelot, CACTUS Director of Community Service.